Mark, and I am very pleased to welcome now Dr. David Severson of the Eck Institute of Global Health. Dave, thank you so much for being here. You are the director. This is your chance to be the cheerleader and support system and tell everyone out there watching Notre Dame Day what exactly the Institute does.
So thank you so much, Tricia. It's a pleasure to be here. The Eck Institute for Global Health has really developed from a long history of faculty engaged in research primarily on tropical infectious diseases. We go way back to the late 1950s. It was started by Dr. George Craig, was an eminent medical entomologist who started a lot of the work on mosquitoes and mosquito-borne diseases. In the 1960s, Paul Weinstein came in, who was a parasitologist, and we built a core of faculty who were engaged in these tropical infectious diseases. And in the late 1990s, a group of us came in to continue that legacy. We organized a center for tropical infectious disease research. And then in 2010, or 2008 to begin with, as part of the Provo Strategic Research Initiative, we got some funding to get going as a group, and then we received a generous endowment from the Frank Eck Sr., and the family committed to that, and so we've been able to build the Institute around that. So we presently have upwards of 80 faculty involved with the Institute. We're still largely engaged in research on tropical infectious diseases. Our mission is really looking at, what can we as Notre Dame faculty do to make a difference in these developing countries where these diseases largely impact poor people.
Certainly, you saw a need, and your research is directed exactly to focus exactly on what is needed there. Mm-hmm. Dave, I remember 20-some years ago doing a story when this was first being thought of and in the first beginnings of this research. Tell me where you are now with this and what ground has been gained.
Mm-hmm. So there have been a lot of successes made in some of these diseases. So there's a whole.
Now there's a long list of diseases, and there's also diseases that have a lot of letters in them too.
Exactly. So we have faculty who are actively engaged in malaria research. Mm-hmm. Virus research, largely dengue virus, things like leishmania that's hard to say.
Yes, that's the one I was thinking
of. People who work on tuberculosis, bacterial diseases, some of the things that you're more familiar with, staph infection, pseudomonas, things like this that may be hospital acquired. But a large part of the success has been relating to some of the mosquito-borne diseases. We have faculty who are actively engaged with large GATE Foundation-funded projects looking at ways to intervene with the mosquito and prevent mosquitoes from transmitting parasites like malaria to humans or viruses like dengue to humans. So there have been some successes in that, largely in terms of bringing down the death rate. The death rate due to malaria has really plummeted over the past 10 years, largely with a lot of the insecticide-treated bed net use and things like that, removing breeding sites, and a number of our faculty have played major roles in driving that.
Well, here's what I don't think people can really appreciate unless you tell them exactly what conditions are people researching in. We're not just talking laboratory. This isn't a sterile environment. You guys actually put your boots on the ground and you're in these areas researching.
Right, exactly.
You have to not only encounter incredibly difficult environmental challenges, but also the political environment and the cultural environment too. How well received is Notre Dame in these areas?
So I can say that of all the field work that I've ever done, and I'm sure I can speak for everybody else, that when you go into these sites, they're very warm and inviting, that they're just happy to have people come in, and I actually love it. It's great to interact with people. I'm a mosquito biologist myself.
Well, and Dave, tell everyone what your research is. It's a little bit different than some of the ones that we've been talking about.
So I've worked on a number of mosquito-borne diseases and with a number of mosquitoes over the last 2 or 3 decades, but primarily involved with dengue virus transmission. And so I've had a long-standing research program in places like Trinidad and Tobago and the Southern Caribbean, so it's a great place to do work.
I was going to say,
Great
you don't
people.
mind going, huh?
I've got a small project funded on the mosquito that transmits dengue with collaborators in Cuba, of all places. And I've had a small project funded with a collaborator in Pune University in Western India, looking at, you've heard all this press in the literature and in the media about humans and the microbiome and all of this stuff. We are what our bacteria are, but we're doing that same thing with mosquitoes, of asking questions about what kind of bacteria are associated with the mosquitoes, and does it have an impact on their life history traits, including dengue virus transmission, things like that. So, I typically go into a field site, and a field site would be somebody's yard. I can't imagine in the U.S. we would go in and say, hi, I'm studying mosquitoes. Can I come in and pick around your yard and your house? And they've always invited me in to look for containers around the yard, and also in their house. They'll invite you into their house. I sweep net in people's bedrooms and in their closets, and this just wouldn't happen anywhere else. So I've always had an incredible time, and it's the other really, really nice part is that usually children come out to see what you're doing. So I've had some really great interactions with
what
kids.
What a unique perspective
yes,
you're able to share
so
and experience.
It's really wonderful. It's really wonderful to get
Dave,
out with the
thank
people.
You.
So.
And good luck to you, and continued success to you and all that you're doing with your research and also with the Institute. Congratulations.
Thank you very much. Appreciate it.
And enjoy the rest of your Notre Dame day, okay?
All right, thanks.
All right.